www.cdc.gov/vaccine. So we want to encourage people to go there as they're seeking information where they can get this vaccine. And following state guidelines, we are going to continue to vaccinate our frontline firefighters, our emergency medical personnel to get the vaccine first and foremost. And then we are prioritizing our homebound seniors with the partnership of the CVS and Walgreens. They're going to the nursing homes and the assisted living facilities. And then in the county, we are going to be visiting our seniors who are living in senior housing, who are homebound, as well as those we care for through our social service agency. These are people that cannot get out to get the vaccination, and we will be working with them to go to their homes. We're also going to target our employees 65 plus, and we've sent out a survey today to see who's ready to get those workers. And we want to be sure that our transit workers, our police, our water and sewer employees that are most at risk, those above 65, will be able to get access through the 5,000 that were provided to us of Moderna vaccines from the state. So this is a critical step in ensuring the safety of our employees and also the public. And we are going to begin our vaccination at County Hall on Monday, January 4th, not at County Hall, but for our county employees. Any remaining vaccines after these priorities, we will be bringing to the homebound seniors who may not live in county facilities, but in partnership with our cities. So it is really important for people to understand that we are all taking care of the elderly and the most vulnerable across the county first. Be sure to visit our website. We also have updates and educational resources there. And in partnership with Jackson, we're rolling out a total communications plan. And our two celebrities today who bravely took the vaccine, they're going to be prominently featured to help reassure the public that it is safe and effective, and we need to work together to educate the community. So look, we're not out of the woods. The cases are still rising, unfortunately, and we must continue to follow all the protocols. Masking, the most effective, social distancing, hand washing, disinfecting. We all know, avoid large indoor gatherings, stay with your families, wash your hands, wear your mask. So as we are working together to continue to keep our community safe in the weeks and months ahead, I want to thank Dr. Page, our Chief Medical Officer, also Chief Medical Services here at Jackson. And Dr. Page, I just want to acknowledge you. There he is, and of course he's available for any questions. Gracias a Jackson y el Dr. Page, a la presidenta interna de la comisión, la presidenta interina de la comisión de Miami-Dade, Commissioner Sosa, y también el presidente electo de la comisión, el comisionado Díaz, por su liderazgo, y Danielle Cohen-Higgins, la nueva comisionada del Distrito 8, y por nuestros estrellas hoy, Emilio y Nat, que recibieron la vacuna para acompañarnos hoy. Este nuevo lote de 15,000 vacunas Pfizer estará disponible para personas mayores de 65 años y pueden comenzar a programar citas para vacunarse aquí en Jackson, al norte, al sur y aquí en el centro. Estamos coordinando con nuestros socios para vacunar a las personas mayores de lo más pronto posible, y el condado también ha recibido 5,000 vacunas Moderna del estado para vacunar a los bomberos y personal de emergencia que quieren la vacuna. También usaremos estas vacunas para las personas mayores en viviendas públicas y que no pueden ir en persona para vacunarse. La vacunación comienza el lunes 4 de enero. Las personas pueden encontrar información en la página web miamidade.gov/vaccine. También estamos vacunando a los trabajadores del condado de primera línea mayores de 65 años, como los de tránsito, policía y los empleados de agua y alcantarillado. Debemos continuar con las medidas necesarias: distancia social, evitar las grandes reuniones, lavarse las manos con frecuencia y usar las mascarillas, lo más importante de todo. Sigamos protegiéndonos. Gracias a todos, y ahora vamos a escuchar la presidenta de la comisión, Rebecca Sosa. Con gusto.
Thank you so much, Madam Mayor, for joining forces, for bringing us all together. Jackson, no words to thank you for what you're doing for the community. Each and every employee of this hospital have walked the extra mile to save life. And the reason that that is so important is the message that we need to give you also to the media. Thank you, because the only way we're going to be able to communicate to the community that needs to have the vaccines done is because of you helping us to reach them. So thank you to all. And I am one of the persons that is here to say that when the age group was lowered to my age, my doctors told me you have to have the vaccine because I have 5 underlying conditions. And I have to say that I had my vaccine Monday here. And I can tell the community that the only thing, the only side effect that I had was a little bit of pain in the arm, in the place where the vaccine was. Nothing else. So those that are afraid, things can happen, but in general terms, I can tell you that it's very safe. I qualified because of the age. I qualified because of my underlying conditions. Those who are at home, call your doctors, ask them if you need the vaccine. And Jackson, together with the government, with all of us, the new chair like Jose Pepe Diaz, Commissioner Cohen, and the mayor, and all my colleagues in Miami-Dade County, we will work together to make sure that our community goes back to normal as soon as possible with the vaccine. And may God bless you all on the new year and keep everyone safe and healthy. Thank you to Jackson for making miracles every day. Thanks a million.
Good afternoon. Yes, it's a beautiful day because as we saw, we have a solution to the problem that's been dealing with us for now some time. And we're very glad to be here, especially thankful of the hard work and the dedication of the people that do this every day, that have been doing the front line every day, working and saving lives. And those are the people that are my heroes. I would tell you that Jackson is incredible, and every hospital in our community that has done everything possible to save those lives and also do it in a way that the respect of those that are nervous and hurting and want to know how their family members are that are in there. It's a very difficult time and a very difficult situation, but the professionals in Jackson and other hospitals have made it something that people could understand and believe in and continue to believe in. And this shot is a great opportunity for all of us to help stop this pandemic. I know that my colleague, the chairwoman, just recently did it along with one of my other colleagues, also did it. When it comes to our turn and our moment, we'll do it too. And I will tell you that we're blessed that at least we see the light at the end of the tunnel of this pandemic. And I am very proud and honored to stand here with such great individuals that do this every day. And I'm very proud of them. And I think you want to hear more about them than from me. God bless you all. Thank you.
Hello. I think today is an important day to send a message. I think it's a lot of misinformation. People need to know that we want to take a chance. It's the end of the year. We want to bring hope to people. We love the United States. We want to get people back to work and bring hope to a lot of people that to be able to find a normal life. Thank you for everybody at Jackson for doing this. And we wanted to take a chance because we got the right information. I hope everything does well. We'll be able to help a lot of people, and especially people that feel that this has been so incredible, devastated to us. So that I think something doing this is definitely going to be a chance to be able to save a lot of lives. So thank you so much. It's the end of the year. Happy New Year, and let's hope and bring a lot of hope. The beginning of next year, I think we can bring a lot of hope to a lot of people with that. Thank you so much. Happy New Year to everybody. Pienso que un día como hoy, pase 30. Un día como hoy es histórico porque hemos visto un año que ha sido muy difícil, que hemos perdido muchas vidas y muchos trabajos y hemos perdido esperanza. Haciendo esto, gracias a Jackson, a todo el mundo, los comisionados que están aquí, que han trabajado tanto por esto, y la alcaldesa, vemos que estamos haciendo esto para mandar un mensaje de esperanza y tener la información que mucha gente no sabe, que esto solamente puede traer luz a un año nuevo en este gran país, con esto yo creo que trae unidad de ver que esto le puede pasar a cualquier persona y ojalá que podamos salvar muchas vidas haciendo esto que estamos haciendo y que solamente un año que viene lleno de esperanza más que todo. Así que un feliz año a todos ustedes y ojalá que todo se haga de la manera que todos queremos, que sea positivamente para todo el mundo. God bless America.
Good afternoon. First and foremost, let me say thank you to Miami-Jackson. You know, they've been a stalwart of this South Florida community for as long as I can remember, going back to when I was a teenager and having to have my appendix taken out here. So when I got a call from Jackson Memorial Hospital asking me if I would be willing to come out and be a part of getting the vaccination and showing South Florida that it's safe, I jumped at that opportunity. You know, so many times in the African American community, we feel like we get left out. We feel like we're guinea pigs. Well, you know, this is an opportunity for us to be on the front door. This is a chance for the African American community, minorities in general, to have the chance to get vaccinated and, believe it or not, give yourself a chance to survive this bad pandemic. This is just the vaccine does not cure everything, at least I believe, but it's an added. It's an added. And we all dream of getting back to some type of normalcy, getting back to the way things were. The only way that happens is that we all roll up our sleeves, we all get engaged, we all get involved, and do the right thing. And I encourage everybody out there, not just minorities, everybody, that if you're 65 years or older and you have a chance to get vaccinated, please do. Don't just think about yourselves, think about your family, think about your friends, think about all the other people that you come in contact with. You know, it's not just about you. It's about the totality of the South Florida community. So I encourage everybody, when the phone rings or you get an email or a text that says it's time and you can get vaccinated, please pick up the phone. Please respond. You know, do your part to make South Florida a safer place again. And other than that, I just want to say thank you to the media for you helping me get the word out. Because the only way we fix this thing, the only way, is that we all roll up our sleeves and get engaged. And I thank the folks at Jackson, I thank the folks down at the county commission, because without everybody, nothing gets solved. So thank you.
Good afternoon. As you know, Jackson was one of the first hospitals in the state to receive the vaccination earlier this month. We vaccinated over 5,000 frontline workers, which included doctors, nurses, techs, environmental workers, therapists, and many, many more. We're fortunate that we were able to vaccinate every frontline worker that wanted to get the vaccination on the first round. We also coordinated with the other health systems in Miami-Dade County to distribute some of our vaccination, about 9,000 additional vaccinations to the other healthcare systems throughout the county so all the frontline workers can get vaccinated in an expeditious manner. Once we completed that, Governor DeSantis gave us permission to use the remaining vaccinations on existing patients that were 75 and above and recently 65 and above, which began about a week ago. Hundreds of patients in our community have received these vaccinations in our centers. The vast majority of these patients are either underinsured or uninsured, but they've already received the doses. The governor's office recently notified us that an additional 15,000 doses of the Pfizer vaccination will be available, and to assure that we expand the campaign to individuals 65 and older. We're going to do this in 2 steps, and we're going to reach out to as many people as we can in a very expeditious manner. First, beginning this week, we're reaching out to more than 10,000 patients who are 65 and older in our community and that have received their ongoing care at Jackson. This includes many of our patients that are with our transplant programs, heart surgery, cardiology, and many, many other critical care areas. These are the patients that really are at higher risk for COVID. Based upon the response, we believe about 25% of those 10,000 will want the vaccination immediately. Second, and most importantly, we plan to open an online platform next week for any person over the age of 65 that has the desire to have a vaccination appointment. We know that 15,000 doses doesn't sound like a lot, but it's a start. And when you compare it, we know that the demand is going to be a lot higher. But really what we're trying to do is ask everyone to work through this process, and we want to do this in an organized manner. So stay tuned for our online platform on that. Clearly, we continue to work with Mayor Levine Cava, Governor DeSantis, and his staff as well, the entire supply chain, to support the efforts to vaccinate everyone as per the governor's plan as quickly and safely as possible. So thank you very much for supporting us. I want to make sure, as many others have said, lots of thanks to the frontline healthcare workers at Jackson and throughout Miami-Dade County. They're our heroes. They're the ones that are making this happen every single day. Thank you.
Now we have Dr. Norman Einsbrook and his wife of 67 years, Edith Einsbrook.
Well, if you look very carefully, you can tell that I'm a member of one of the groups at risk. After spending an hour here, I feel that I'm less vulnerable and probably more likely to tie my father's record of longevity of 98. Let's hope that this vaccine works very well. I'm going to divide my the time that I'm allowed by introducing my wife Edith. Everybody knows that behind every successful man there stands an astonished mother-in-law. That is a joke?
My name is Edith. I'm a retired physical therapist. I started my career in 1957, and my caseload was polio patients, patients who've been crippled by polio. None of you here, and probably no one who can hear us, has ever seen anyone with polio. That's because vaccines were developed that took care of that dreadful disease. Now we have another wonderful vaccine. The vaccines are miracle drugs, and we are so happy to be able to have received the vaccine today. I encourage everyone who hears this to get your COVID shot. It's a miracle. Thank you.
And last but not least, Patrick Range Sr. He also got the vaccine today, and then after he's done, we can move on to questions, okay?
It's a pleasure to be here, first of all, to be among this very distinguished group of people who have received the vaccination today. I am a funeral director who daily comes in contact with persons who have expired as a result of the virus. I think it is very, very important that if given the opportunity, that certainly it is to the individual's best honor to take the vaccine, to see patients who have died from the virus, to deal with their families, gives me to know that indeed we all must be very conscious, we all must do all that we can, and certainly if given the opportunity to receive the vaccination, that indeed we should do that. Again, I thank the Jackson facilities, I thank the mayor's office, I thank all who are working so very diligently to help to turn this virus situation around. Thank you very much.
I know you had some questions. I know you wanted to ask questions to Emilio. No questions? You do? Who do you want? For the who? I'm sorry.
I think for the mayor, about how many employees.
Oh, Dr. I didn't hear. This is a very noisy location.
I know, but I can't hear you.
Should I just go talk to Doug, or do you want to?
No, I think he had a question.
Go ahead, please.
So can you just go through again, are the homebound seniors in public housing getting it after the county employees or before?
No, we're actually right now developing the plan to go to the homebound seniors, and then we are also surveying our other 65 plus employees to see their readiness, and they won't be the next ones.
And what are you hearing so far regarding the willingness of firefighters and paramedics to get the vaccine?
Right. Well, unfortunately, in the general public, there hasn't been yet the enthusiasm for the vaccine that we see in the 65 plus category. So I think it's really important that people are observing what's going on, making sure that it's safe. The fact that we have people here who have put themselves out to communicate to the public that it's safe, our very own commission chairwoman, other people that are well-known figures, and they are really begging the public to participate for the safety of all of us. Yeah? You wanna say anything?
Any plans